bit about an introduction. Thank you so much for coming on board for this. We're really really grateful and we're very excited for this conversation. So I'll just begin by giving you a little bit of introduction about myself. I'm Mishal Gyani. I'm the manager of programs and outreach at Gallup, Pakistan. So, and I also want to let everybody, in case they're not joining, and everybody who is here, I want to let everybody know a bit about Hammad. So Hammad is is an Islamabad-based research consultant and has worked on several research projects for clients in public, private, and third sectors. And his areas of interest include macroeconomic insights, healthcare market, ICT-based sustainable business models, financial inclusion, and sector-specific research. And he's obtained his MBA from IBA in Karachi and in 2016 and graduated with two gold medals. So thank you so much again, Hammad. So in this episode, where we are going to be exploring a major component of the healthcare landscape in Pakistan, which is healthcare infrastructure. And with the pandemic specifically, this component was very widely discussed, and it has been quite interesting to see different rising trends within this. For example, like the increase in the use of at-home devices or digital healthcare or telemedicine. So, without any further, delay, I would like to now just give the floor to you, Hammad, and you can just present your insights on this specific topic, especially against the backdrop of the pandemic. So, I'll just hand it over to you now.
Thank you so much, Michelle, for your introduction, and I'm grateful to Gallup Pakistan as well for this opportunity to share some insights from a recent report that we did with the Swiss Business Council on behalf of the Switzerland Global Enterprises. I was the lead consultant in that study. So you guys can, log into the web and access the report via this link. And we'll be sharing some data and insights from that report in the interest of, sharing these insights so that a lot more people can benefit and spread this report around, and, so that we can take the conversation forward. So we are, excuse me, Michelle, please let me know if my voice breaks at any time. So
I will.
I'll reach fine. Right. Right. Thank you. So the topic is Pakistan's healthcare market, medical devices sector, and the digital healthcare sector. I have broken this down into those three precise themes here, and we'll discuss them one by one. The first up, before I go any further, I really want to show our appreciation for all the healthcare workers out there in the market, out there in the hospitals, clinics, and nursing homes, who have really put themselves out there during the pandemic. They were the frontline heroes. And while we here are discussing or doing research, they are actually the people who are in the arena, and we can never thank them enough. And the least we can do is, recognize their contributions to society. They are the ones who kept us safe and kept us going. So with that, I'll start our presentation today. First up is Pakistan's healthcare market. Over here, some of you may already know the numbers or the structure, but it is worth going through that again. Pakistan's healthcare system is basically it's a two-tier system. One is the public healthcare system, and the other is the private healthcare system. Within the public healthcare system, we have three tiers: the primary, secondary, and tertiary. It grows with the level of sophistication. Primary is basically the most basic form of care. Then there is secondary, where you get a lot of referrals. People get some inpatient care as well. And tertiary is where you have specialized hospital where a rehabilitative, surgical, or therapeutic care happens. Then there is the private healthcare system. Over there, you have number one is the formal healthcare. This is where you see lots of private hospitals of different sizes, private clinics. Then you have private laboratory and diagnostic and imaging service providers as well. Then you have the informal healthcare providers. These are basically they operate in the gray area between they operate in the gray area. These are mostly the hakims and the tabibs and the healers and the soothsayers, etc. And third is you have philanthropic healthcare, which is kind of part of formal private healthcare, but is different in the sense that it doesn't charge anyone. These include both local NGOs and international donors for providing services, especially in rural areas. They have some establishments in urban areas as well. It's mostly rural areas. The regulatory environment is a bit fragmented. At the federal level, naturally you have the federal authorities who devise national health policies. They create universal service requirement. They establish quality standards. A few bodies I've listed here. The list is actually quite long, but the main ones are the Drug Regulatory Authority of Pakistan, and the National Institute of Health, and Pakistan Medical Commission, and others. Whereas the healthcare delivery, actual healthcare delivery, is the responsibility of the provinces. This happened after the 18th Constitutional Amendment in 2010. What happens is that the provincial health departments are responsible for primary and secondary healthcare delivery through respective district and tehsil governments. I have listed here some snapshots from the report. You can always refer to the report for more data. The primary healthcare infrastructure in Pakistan, these numbers need to be updated. I mean, these are pretty updated, but the infrastructure is being added up as we speak. So at the basic level, you have the basic health units. There are more than 5,000 around the country. Then there are rural health centers, about 700 dispensaries, more than 5,000 dedicated maternal and child healthcare centers, more than 700. There are more than 100,000 lady health workers operating in Pakistan. And this basic infrastructure is very critical in Pakistan for a number of reasons, for population planning, for epidemic control, and for dedicated vaccination campaigns like the polio vaccination that you see every now and then. The healthcare infrastructure. This is basically, I'm talking about the public healthcare infrastructure over here. Then there's a secondary healthcare infrastructure where you have more than 100 district and tehsil headquarters in Pakistan. So, and then tertiary hospitals, about 42 teaching hospitals and 1,000 major hospitals, both with the government and the military. In terms of overall healthcare infrastructure snapshot, we have close to 2,000 hospitals in Pakistan. Now, 2,000 may sound like a very big number, but these are not all very large hospitals. What happens is that to the one corner of the country, you'll see very small hospitals, medium-sized hospitals, and hospitals that fall between medium and large. But mostly these are small and medium-sized hospitals. Within that, public sector hospitals, 2/3 of the hospitals belong to the public sector, about 1/3 belongs to the private sector. Those are the number of beds in Pakistani hospitals, and you can see that there is one bed availability for more than 1,600 people. Number of registered medical personnel in Pakistan, about 250,000 doctors, more than 100,000 nurses, about 50,000 wives, and more than 25,000 dentists. These, I mean, depending on your perspective, these may look like very big numbers or very small numbers. But the problem in Pakistan is that most of the registered medical personnel are concentrated in the cities. They are not evenly spread out across the country. If rural areas are more than 60% of the population, you won't find 60% of registered medical personnel practicing in the rural area. It's actually quite less. So there is that disparity, and the pandemic has actually highlighted. And that's why you see a lot of pressure towards the cities. A lot of people have to go to the cities, pay for the transport, pay for the accommodation. So that's another added challenge within our healthcare system. Next up, some numbers. Some of you may already know them. I will just go through them. And I've tried to sort of provide heuristics here because sometimes it is not easy to remember the headline numbers. So this is the overall healthcare spending in Pakistan. If you look at the left side corner of this slide, this includes both public and private sources, which means this includes spending by the government, this includes spending by the corporations and companies, and this includes spending by the households, as well as official donor agencies and those working in the philanthropic sectors. So in any given year in Pakistan, in the past decade, the overall healthcare expenditures have ranged between 3 to 4% of GDP. Now, this is not public spending on health in terms of GDP, but overall. So the most recent data that we have is from 2018, when total healthcare spending stood at 1.2 trillion rupees. If we assume a 10% average growth rate per annum, this spending is estimated to cross rupees 1.8 trillion in the ongoing fiscal year, which is FY22. This figure could be much more due to the pandemic, as we have seen that the federal governments, the provincial governments, even the households have had to spend a lot more on their healthcare needs, as the overall level of health consciousness seems to have risen in society as well. Now, what are the major contributors of healthcare spending? What a lot of people in the public sector and the private sector put in front is that about over half of the spending, overall healthcare spending, is made by households. Basically, these are their out-of-pocket expenses. If you are a philanthropic organization or a private enterprise looking to enter the market, this is where you focus. Okay, out-of-pocket expenses, it's about 54% of overall healthcare spending in Pakistan. We'll talk about that in detail a bit later. A third of the spending, overall spending, healthcare spending in Pakistan, is by provincial government. As I said earlier, provincial governments have the lead responsibility for health expenditures is made by the federal government. Another seventh is sourced from philanthropy, which is both local NGOs, foreign NGOs, and other bilateral and multilateral development agencies. However, less than 1% of total healthcare spending that takes place in Pakistan in any given year is linked or connected to the private health insurance. So this is a huge area for intervention, huge area for investment. And this also basically tells you why the share of out-of-pocket expenditures healthcare in Pakistan is very large. The recent reduction of the government sales service program, we need to see how it fits in the market. They have taken a step in that direction. They've involved State Life Insurance Corporation of Pakistan into that. So we need to see how that initiative goes. It's a matter of capacity, but that's not the point of our discussion today. We'll just focus on the other market-related insights. So a lot of people are also interested in where is this healthcare spending going? Well, I have briefly outlined four major beneficiaries. In any given year, about 30% of total healthcare revenues in Pakistan go to public sector hospitals. Now, we need to understand close to more than 40% of healthcare spending in Pakistan is made by the public sector. It's about 45%. So that spending is basically going to the public sector hospitals and dispensaries and basic health centers, rural health centers, maternity and child healthcare centers. So there you go. The top beneficiary is the public sector hospital. About 25% of the spending goes towards buying pharmaceuticals. At the end of the slide, you'll see that half the out-of-pocket expenses of households are actually to buy medicine for different diseases. And the third is about 20% of annual spending in Pakistan goes to private healthcare providers. These include the outpatient clinics as well as private sector hospitals. And about 10% of annual healthcare spending goes to laboratory and diagnostic service providers. These are mostly in the private sector. Now, this is very important to identify the disease burden as well. I have isolated this insight here, which shows that about 3/4 of health spending is directed towards treating 10 diseases. These are 7 chronic diseases and 3 viral diseases. As you can see in the slide on the right side of the slide, the top disease burden in Pakistan is due to the heart disease, which is a chronic disease, followed by flu and fever. Then you have muscular pain of different kinds. Then there's diabetes, then there is liver and kidney disease, and so on and so forth. So, again, if you're a public stakeholder or private sector stakeholders, you need to understand that this is where the bulk of healthcare spending is being directed to. And this is where major interventions are required as well. About households out-of-pocket expenses, this chart I produced here, where does all that money go when households spend their money in the healthcare market? About 54% of household spending private spending goes to private doctor clinics, followed by private hospitals and government hospitals, etc. So that's where it is. So even though you see a disparity here, that even though the public sector is a major spender, it is the private sector that is the major recipient of healthcare spending in Pakistan, primarily because a lot of households have to spend out of pocket. So we'll take questions answered later. Questions later. So I'll just move on to the next part of my presentation, which is about the medical devices sector. So our report, a central focus of our report was to produce market insights and market-related information for Swiss companies that may be interested in investing in Pakistan's medical devices sector. So I have reproduced some insights there for general information, and maybe it can trigger curiosity of other researchers as well. So medical devices are basically the backbone of any healthcare sector. These include from the most basic, I mean, you would be surprised to hear that even cotton wool is considered a medical device. And a hospital bed is also considered a medical device. Capital equipment such as ultrasound apparatus, magnetic resonance imaging machines, etc., are naturally medical devices. Syringes, needles, etc., hearing aids, pacemakers, etc., all those are medical. I will talk about them a bit later. So medical devices are a highly regulated sector because they range in risk and hazard to patients in the overall healthcare system. They are regulated in Pakistan by DRAP's Medical Devices and Cosmetic Boards Division. The main legislation that underpins that regulatory mandate is the Medical Devices Rules that were formed in 2017 and implemented in early 2018. So what is a medical device? There is no fixed definition in Pakistan. However, as per official regulations, a medical device could be one of these two things. It could be used to supply information to detect, diagnose, monitor, or support treatment of physiological, mental, or congenital deformities, or it can be used alone or in combination with other medical devices. Its operation can be dependent on electrical energy source or any other source of power that is directly generated by the human body or gravity. And so the report contains much more detail about this. So I'm just summarizing the picture. So how do you operate as a medical device provider in Pakistan? There are basically two routes. You can either manufacture local medical devices in Pakistan, or you can import them. So there's lessons for both of them. You can apply for a license to manufacture, or you can apply to get a license to import medical devices into Pakistan. There are two phases to get a license. So one is the pre-license due diligence by the regulator, which involves inspecting the premises of the potential licensee or applicant, assessing whether the premises meets a certain criteria. It is in a safe place. It has the necessary requisite equipment. It has the facilities to ensure smooth and safe operations. An inspection report is generated by the DRAP, the Medical Devices and Medical Cosmetic Division team, and if successful, the applicant gets a 5-year license. Once the license is granted, there is continuous surveillance or oversight by the regulator. It again involves checking the premises, whether there are enough trained human resource in that particular field over there, whether there are traceable logs over there which actually track the badges and the minute details about the whole supply chain, whether effective and adequate quality control systems are in place, and whether there is capacity at the licensee's end to ensure that post-market surveillance is in place so that once the medical device is sold into the market, it can actually be seen that way it has ended up. There are 4 kinds of medical devices, Class A, B, C, and D. Basically, the risk level increases as you move up from Class A. Class A is lowest risk hazard, and Class B is the highest risk hazard. I have noted down some examples over here for your benefit. You can always consult the report to find out that there are tons of examples, and I have basically used examples that are cited by DRAP within those for medical device process. But the point is that medical devices range from very simple implements, disposables, and consumables, all the way to very complex capital equipment, electronic equipment, etc. So you can build, I mean, all ingredients that form the health infrastructure are critical. Perhaps the most critical is, and what I referred earlier as the backbone, is the medical devices, because technology is advanced. Now you have robotics-based so-called medical devices performing surgeries, and the doctors on the back end. So the technology has advanced, and it results in a huge amount of surplus for hospitals and patients, and it also improves the safety. So it's a very critical sector. On the right of the slide, I have a snapshot of documents that are required to import Class A devices. The list of documents required to import Class B, C, and D devices is very long, but I've just listed Class A here, so you can get an information of the thoroughness that the regulator has in place to ensure that all covenants to get a license are complied with. I'll move to the next slide. Now, this is also very important. How large is the medical devices sector in Pakistan, and what are the market dynamics? So our research indicates that annual sales of medical devices in Pakistan are about $600 million per annum. This was as of last year. However, 90% of this domestic demand is being met through imports of medical devices. That's why you can see why and how foreign medical firms are interested in this sector. In terms of per capita sales of medical devices, Pakistan is on the very low end, about $3 per person per annum. But on the positive side, it also indicates room for growth. Why room for growth? Because the medical device sector or the healthcare ecosystem is not in isolation. It is part of the broader economy and the broader demography. And what are the trends over there? So you see growing urbanization, rising population growth, increasing health consciousness, higher purchasing power, and the rise of digital care, where a lot of people are now going to book appointments online, or they order their medicines and medical devices online. So there is room for growth. This is a growing market. It has to go up. But currently, it lags behind. For example, in Asia Pacific, annual medical sales per annum per capita is about $40, whereas the global average is about $50. Pakistan is an extensive trader in medical devices. As I said earlier, 90% of local demand is met through imports, mostly from China, US, Germany, Ireland, Japan, Switzerland, UK, and some other countries. We also export medical devices. Pakistan exported about $500 million of low-end medical devices, which you are aware are the surgical instruments last year. Half of those exports went to the West, mostly US, UK, and Germany. Pakistan has a very vibrant surgical instruments sector over here, of which Sialkot, which is based in Punjab, is the dominant cluster. There's a huge amount of legacy, decades-old relationships, networks that these businesses have. A lot of firms over there have contract manufacturing arrangements with the international bodies and organizations and private sector players. It's a legacy business because it has been around for a while. Therefore, they have the infrastructure in place. There is cheaper labor availability, and there's expertise to produce surgical instruments in the cluster of Sialkot. However, there are certain issues because surgical instruments are considered on the low end side of the medical device spectrum. It has to happen that these players or this cluster actually moves up the value chain ladder and fetches more value because they have been building upon it, and they need to level up. But there is limited automation there, which means that the fetch per unit to value is lower. But there is also, on the flip side, there's potential for growth and efficiency and price-based competitiveness in international markets. As I said earlier, they can diversify into high value-added segments, especially non-invasive medical device and surgical instruments. There are issues related to marketing, branding, and limited global value chain integration that continue to hamper local firms' capabilities and their international competitiveness. As I said earlier, no sector operates in isolation. And as you know, Pakistan's economy, every 4 to 5 years, it goes through a boom and bust cycle, which results in high inflation, depreciation in currency, and a very tight monetary policy that raises the cost of borrowing and hurts the international competitiveness of a number of sectors. And the medical device sector or the surgical instrument sector is not in isolation. It is part of that, so it also gets affected. On the right side of the slide, I've listed top 10 medical device exports and top 10 medical device imports. Our medical device exports are mostly low-end surgical instruments, whereas top 10 medical device imports are a bit more complex, as you can see. And you can also see top exports markets and top import regions over there. So the private sector it basically has huge footprint in the medical device sector because this is a privately run endeavor. The main sector association in Pakistan is the Healthcare Devices Association of Pakistan, which is headquartered in Karachi. There are a number of multinational corporations active in local market, and from this list, you can see the likes of Abbott, Bipron, Eli Lilly, Medtronic, Mother and Pibb, Martin Dawson, Roche, etc., and Johnson Johnson as well. Having said that, there are dozens and dozens of prominent local companies that are also active in the local medical device market. I have listed some of them here, and no offense to other companies whose name couldn't be here. But these are some of them, and these are based mostly in big cities like Karachi, Lahore, and Islamabad. And these are mostly importers or traders of medical devices. Now I move to the third part of my presentation, which is the digital healthcare in Pakistan. It is important to define what digital healthcare really means. We use the Food and Drug Administration in the United States definition here. According to them, this term consists of multiple domains. It could be mobile health, healthcare information technology that is at the back end of hospital administration. It could be wearable devices that you use to monitor your vitals. It could be telehealth and telemedicine, or it could be personalized medicine that is that is there, or it could be technology that just helps the overall healthcare system, such as hospitals, clinics, and laboratories to cut their costs, improve efficiencies, improve access and quality of service, and to provide more personalized services to patients. We analyzed the digital healthcare startups in Pakistan. They have been a big thing over the past few years. And the insight that really comes on top is that their business models are mainly targeting three areas. First is the online pharmacy or marketplace for medicine and medical devices. This is where basically you go online and you shop for medicines or order medical devices. So this is on top. Then there is the online booking of physicians or getting doctor's appointments online for physical checkups. Not virtual checkups. Virtual checkups will be telemedicine, which is basically the video consultation. So most of the business models for digital healthcare startups in Pakistan revolve around these three these three kind of activities. Some of the insights to target market. So it would appear that the target market is urbanized consumers or medical customers. And again, as I mentioned before, it is in the cities where you will find higher purchasing power. It is in the cities where you find healthcare infrastructure. It is in the cities where you find decent amount of availability of medical devices as well as medicines. Targeting smartphone users. You gotta have a smartphone and mobile brand connection to access digital healthcare services or people, as I mentioned.
Sorry, Hammad, breaking off. I can't hear you properly.
Okay, is it better now?
Yes, it's better now.
Okay. I'll just repeat the last point.
Sure.
So the demand side factors are there. If you take two of these activities, business models up there, one was basically purchase of medicines. You go on and you purchase, and the other is to go see a doctor. So each of these activities, seeing a private doctor or purchasing medicine, that's a rupees 500 billion activity. Yeah, that's what about $3 billion per annum. So the demand side is there. The challenge for digital healthcare providers is basically to transition that demand online so that people can have online consultations, people can buy online medicine, people can book appointments online. Geographical location, most of the digital healthcare startups are based out of three cities, mostly two cities, Karachi and Lahore. And again, those are the cities where you find a good amount of availability of doctors, nurses, IT personnel, and there is good amount of purchasing power there. So those two cities have good ecosystem for startup growth. So that's where you see digital healthcare startups rising as well. External investment interest, I have listed, I have produced a snapshot on the right side of the slide where you see Pakistan's top 5 startups who have raised a good amount of investment over the past 2 years in 2020 and 2021. And the analysis shows that more than $20 million of investment has been raised by digital healthcare startups in those 2 years alone in Pakistan. Then there is the digital ecosystem support as well. As I mentioned, the big cities, Karachi, Lahore, as well as Islamabad, have a lot of incubators, accelerators, and support system is over there that really helps nurture our digital startups, and the healthcare-related digital startups are also benefiting from that kind of a facilitative support system. This is what I want to focus on here. Telemedicine in Pakistan. Telemedicine has had a huge rise in during the pandemic, all over the world, in Pakistan as well. Previously, we used to hear about in America, the CDC's telehealth, I believe. Yeah. So now we have some great startups coming out in Pakistan as well. But first, it is important to define what telemedicine is. It is basically the use of medical information exchange from one side to another using electronic means. And the idea, the main goal is to improve a patient's clinical health status. It can be done through a number of applications or services. It has to be a two-way video communication using smartphones, wireless tools, or other technologies. The regulatory regime for telemedicine is evolving in Pakistan. Currently, some draft guidelines have been issued according to which there's a two-phase process to obtain full registration. In phase one, if you already have a medical practicing license in other fields, you can apply for a telemedicine practitioner license. You will be awarded a temporary license, by the draft. There are guidelines I have mentioned here. You can later log on to them and see for yourself in detail. So the phase one is that you get a temporary license, and after temporary license, you apply for a certified license, which takes you through a training, online training through accredited institutions. After that, you get some track record and eventually you get a certified telemedicine practitioner license. There are very strict guidelines to practice telemedicine in Pakistan, telemedicine profession in Pakistan. Number one, the nature of consultation has to be one-on-one. It cannot be many-to-many or one-to-many. The application portal has to be secure. The electronic medical record has to be stored properly. The data of the users has to be secured, and for development purposes and to provide more sound policy in the future, the regulator also expects data to be shared. And the telemedicine practitioner, excuse me. And the telemedicine practitioner can not recommend brand names, medicine, or medical devices. They can talk about formula. For example, if Panadol uses a specific formula, you can recommend that formula rather than the brand or the tablet's name to the patient. I have listed in the report, we listed 3 startups or 3 telemedicine, leading telemedicine providers in Pakistan. Over here, I have listed Sehat Kahani. I'm sure some of you will have heard about it. It was founded about 5 years ago in Karachi. And the business model is very simple and very interesting and very timely. As you know, that there is the situation in Pakistan where a lot of females who have had medical education for cultural reasons, they are unable to practice their profession. Secondly, there are backward areas or rural areas where you can't find any female doctor, and even availability of male doctor is a problem. And then there is the income question. People may not have enough money to spend on transport or go to the city. So startups like Sales Kahani basically solve that problem. They have these e-health clinics where a female nurse puts together a group of female patients in person and then connects them a female doctor who may be living in a city uh, from her drawing room or from her working table through an online platform. And for a price that is about less than $1, a female patient can speak with a specialist in fields like pediatrics, gynecology, psychology, and other disciplines. These e-health clinics also provide support to those patients getting medical tests done, because without the medical test you cannot get a clear picture of where the patient's physical situation is at. Then there is e-health app as well, where female patients can consult one-on-one with female doctors in dedicated specialties at a time of choosing of the patient. Consultations usually cost less than $2. The impact is huge. They have set up dozens of e-health clinics with the help of more than 150 community staff, and they have provided more than 2 lakh online consultations. So they saw a real need, they're solving a real problem, which was cultural, economic, demographic, and it was just a perfect storm. And this is where you see, digital disintermediation, how it is really helping a need in the offline world, taking it to the online world, connecting it with people who are specialists and connecting with people who really need that service, and creating, public good. So that's about it. I was really fast. I'm sorry for that. I do have time for some questions, so I'll be happy to answer. Thank you.
Right. Thank you so much, Ma. That was a very interesting presentation. So yes, I the floor is open for questions. I think I will start with one. So one of the things that I also kind of seen is that normally when it comes to quality of healthcare services, the private sector, it does seem to provide like better quality services, and for those who can afford, there is a preference towards private sector facilities, right? So I just want to kind of understand or see, what is that room for collaboration between the private and public sector when it comes to medical devices? And just in terms of also, how do you see there that, them coming, those two sectors coming together when it comes to medical devices and even just healthcare infrastructure in general? For example, there could be referral systems, right, which we have at different levels of like government facilities. We do have referral systems there. So do you see that potential, or do you see that collaboration between the private and public sector as well when it comes to medical devices or anything else within healthcare?
Absolutely. Thank you so much for this question. So we did talk about the quantitative part of healthcare spending. I did not speak about the quality side. Quality of spending is very important. If you're spending $100, not getting quality, that's no good. And if you're spending $50 and getting good quality, you may be better off. So the main difference between the public sector and the private sector in terms of quality, and I will get to your question, answer your question, just a little bit of background. The main difference is the accountability. Now, a lot of good things are happening in the public sector hospitals and clinics. They are still the backbone. They still form the bulk of your healthcare infrastructure in Pakistan. And a lot of people are getting services from those institutions, public sector hospitals, etc. So I'm not saying that they don't have that they have zero quality. They do have certain level of quality. It needs to be improved. The problem is accountability. Over in private sector, you will see a good service primarily because of accountability. People have contracts, or people have jobs, there are assigned objectives, they're being monitored, there's a chain of command, and usually politics is everywhere, but in private institutions, results are more important. So politics sort of, sometimes takes a backstage. And the medical devices sector, especially, it is very difficult and costly to maintain a medical device. For example, take the X-ray machine or ultrasound machine. If you do not maintain it properly, or if you do not perform predictive maintenance, that machine will go out of order. And then you'll have to call the vendor. The vendor will take many weeks to come, and the machine will have to be dislodged, taken elsewhere, maybe even out of Pakistan, because most of them are imported as they are complex machines. And then you are out of service. So it happens in private sector as well. Big hospitals, even big hospitals, have huge departments dealing with medical devices and apparatus like ultrasound machines and other diagnostic and imaging equipment. And even they have a lot of difficulty performing proper maintenance. So they hire people with expertise, they pay them well so that they don't run into those kind of issues. So the question of collaboration between the public and private sector, I can see that this vehicular program that has been brought in, if it gains some traction in the market, there can be an indirect impact where, because this program allows for people to go to private hospitals and not have to pay out of pocket, because the public insurance will take care of that. So that may indirectly provide an incentive to the public sector hospitals to level up their game and sort of be more accountable. Otherwise, politicians or ministers will ask the questions, why do we even need public hospitals if you cannot service a certain number of patients in a given amount of time? So that may indirectly provide impetus to boost the quality and accountability in the public sector hospitals. Other than that, I don't think there is a lot of scope for collaboration between public and private sector hospitals. Sometimes it happens that the government brings in good quality resource from private hospitals abroad or in Pakistan back to the public institution. We have seen that in the case of Punjab Kidney and Liver Institute. Overnight, institution was built up by a private sector specialist, and it has scaled a lot of heights. So there are institution builders in the private sector. They can be brought in, and the professionals can be given the jobs, and but it is a bit tough to operate in the public sector for those private sectors. I would have to say.
Okay, yeah, that I think what you're saying makes sense. So I do have another question as well. So,
Sure.
with COVID, of course, we did see that there were a lot of like imports as well, and then also there was a lot of local production when it came to different healthcare services like masks or healthcare. Which would be medical devices, right? Like which would include masks, etc. as well. So I'm just wondering, now that we are on the mend somewhat with COVID-19. So how do you see, international investments, or how do you project that growth would differ now, or
Sure.
So if you could just speak a little bit about that, that would be great.
Excellent question, and I will actually link you with the global public health security. There was a study released last year which said that it would have just cost $5 per person in the world to prepare against the pandemic, whereas the world actually lost $20 trillion, which was about more than $2,000 per person, $3,000 per person. So you could have just spent $5 to prepare for the pandemic, whereas you actually lost $2,000 to $3,000 per person for the pandemic. So the pandemic is becoming endemic in a lot of places right now. So people tend to forget, and people tend to have more short-term memories and more short-term priorities. But it's very important what you highlighted from the supply chain point of view and from the public sector demand as well. We all gotta be prepared for the next pandemic. And producing these PPE as well as materials or disposables or consumables like masks and gloves and other gowns and everything, the world needs to have a sort of a strategic stock or a safety stock or a buffer stock of these supplies so that, and this is very basic, so that when next pandemic strikes, not if, the world does not run into chaos and ships of different countries are being intervened mid-ocean and taken elsewhere. So on a basic level, your question alludes to that. So how does Pakistan benefit from all that? Pakistan has a natural advantage because of being in the global textile value chain. We have heard a number of stories that overnight some Pakistani textile factories retrofitted, and they were able to produce hospital textiles, you know, and all those things. So I guess now is the time to sort of see where the focus should be, where those investments can be made, because naturally the demand of those goods is not extraordinary anymore. It will become normal demand. So you cannot expect a textile factory owner to continue producing all that. Having said that, some valuable experience has been learned, and the government can sort of strategize in this direction. That okay, there may be a market for this, and how can we actually incentivize our own players to actually improve their quality, because now it's the game of quality and not mass supply. So I think my thoughts are going in that direction. It is linked with global pandemic preparedness. It is absolutely critical. Many global healthcare experts have warned that the next pandemic is actually on the horizon, and it is just a matter of time. But we as humans, we tend to forget and we tend to move on, and that's kind of sad, but that's the way it is.
Mm. Okay, thank you so much, Hammad. I just want to open it up to if anybody else has any questions. And
Sure.
so we do have a question. Yes, you can unmute yourself.
Hi, is it okay if I go first?
Yeah, sure.
Okay, thank you so much, Hammad, for this wonderful presentation. I think it was super useful to kind of know more about what's currently happening in the digital health sector. But something that I was curious about, and when you were talking about how there is now, we see that we have these local startups sort of converting this landscape of like making sure that the healthcare facilities are now accessible remotely as well through digital tools. I guess my question is like, how much of that do we see in also expanding access to rural populations, right? So one of the things that you mentioned was how currently, because we see that a lot of it is being provided by the private sector, right? And we've also seen like a lot of these apps like for medical services and medical appointments and stuff have risen up post COVID. So my question is, how much do we see that happening for the rural population as well? Like, do we see any sort of startups emerging that make this super important to ensure access of healthcare services to rural populations as well?
Thank you, Asha. Great question. As I highlighted earlier in my presentation as well, there is like an urban bias in the healthcare system overall, and naturally you will see that in the digital healthcare service provision as well. Having said that, this avenue has a lot of relevance and importance for rural areas, provided connectivity is there, provided some commercial element is there for the digital healthcare provider. As I noted earlier, Sehat Kahani is doing less than $1 per person to have their e-health clinic accessibility. But the problem is, I believe the problem is far bigger for just digital healthcare providers or telemedicine firms to solve. We need a whole transformation for healthcare to work for rural areas, especially women and children, to work for them as well. What do you need? What can be done about it? So I personally feel that while telemedicine is great and everything, you still need systemic change. You need physical presence of a lot of doctors and nurses in underserved and unserved rural areas, those pockets that are extremely neglected, some form of primary healthcare infrastructure over there. Referrals can take place. Okay, you can go to a city for acute care operation. That's fine, but at least provide them the basic service, provide them the maternity advice, provide them the little pediatric care. We can prevent a lot of misery by just accessibility of some form of services over there. So some people advocate that we need to have a sort of a mandate where medical professionals, once they graduate, have to serve in rural areas for a couple of years maybe, so that an ecosystem develops where young doctors and nurses not only do they go there and fill the service gap, but they also get sensitized to the real healthcare challenges that this country has. I'm not personally in the favor of mandates where you impose that kind of a vision for transformation on young graduates. But I also see that the challenge is huge. Without physical presence of individuals over there, medical personnel over there, I do not see how how the service gap can be bridged to a reasonable degree.
Yeah, great. Thank you so much. I think that's a very good idea. I don't know if that could be done nationally, like you said, like imposing a mandate,
Yeah.
but just encouraging urban medical graduates to like go and spend some time in rural areas and all, like making sure that rural populations also feel heard and feel seen when it comes to like healthcare. And I think because this is like it's a basic service. So if at any point in the future we are trying to achieve universal health coverage, if that's like our, let's say, national aim, then I think this is one of the great ideas to at least like get started with it. So thank you for that.
Absolutely. And I'll just add here, Asra, that with the Sehat Sahulat program that the current government has launched, so basically, without going into any criticism, just pointing out a fact that that program has been launched onto a certain capacity of healthcare that we have in this country, with all its inadequacies and biases or coverage gaps. So my worry is that this program shouldn't exacerbate existing inequalities in healthcare, and that basically links to your question. So it would be amazing if, as a result of this program, or despite of it, some form of healthcare infrastructure can be increased in rural areas, and otherwise, those people living in rural areas will keep rushing to the cities, and that's a very messy process, time-taking, time-consuming process. They have to spend so much on transport, and I know that the government has announced a transport subsidy as well. You have to see how it works, and then they have to spend on accommodation. You visit any large hospitals in Karachi, Lahore, Islamabad, you see public grounds near that hospital filled up with people having to sleep out in the open for many days on end. And that's the kind of picture that we have. And it is very important to, improve the capacity of healthcare infrastructure in rural areas and to manage properly and to provide quality service. So short of a mandate, I'm not sure how persuasion or moral suasion can help. I don't think there are any easy answers here. But thank you for your question.
Thank you so much. Are there any other questions?
There was one more, I think. Yeah.
Yes.
Yeah. Hi. So I just wanted to thank you for your presentation. It was really insightful. I wanted to ask, so you sort of mentioned in your presentation that the quality of medical devices within local brands it's perceived to be lackluster, and especially in comparison to international brands, I've noticed that it is perceived to
medical
be
devices. Just medical devices.
Yeah. So
Okay, let me just clarify. So it's not that we are importing because we're importing 90% of animal demand because local quality is lagging. Most of that 90% is not even being produced locally. So a lot of surgical instruments that are being produced in Pakistan are being consumed locally as well. And the surplus is exported internationally, you get better rates as well. So let me just say that like that. We are not producing ultrasound equipment in Pakistan, MRI equipment in Pakistan, high-end, catheters, etc. We are not doing that, so we have to import them. So just to put it out there. Yeah.
Okay, thank you so much for your clarification. So I just essentially wanted to ask, so how can we sort of increase market penetration by international brands within the medical devices market in Pakistan? And should we even encourage such penetration in the first place? So yeah.
Okay, so if I understand you correctly, Amna, you wanted to ask if more foreign players should be encouraged in Pakistan to come into the sector. That's your
Yeah.
Okay. So that's a great question. We need to understand that medical devices range from simple to complex, and it is those on the complex side that we basically need to import, and some on the medium end as well. I believe that investment into the sector is very critical. Currently, we are importing, and our needs are going to grow, in line with other market fundamentals. So we need technology transfer, we need expertise, we need foreign investment. So a foreign investor who wants to enter this market has a number of options. They can just export it into Pakistan, which will be our import, or they can just import through their own country office over here, or they can, create a joint venture with a local Pakistani company and produce some components of their medical device in Pakistan or assemble it here. Or they can just bring their own manufacturing plant here and produce that device over here. So there are people who say that because obviously imports are a big issue for the economy when the economy heats up and then there's a balance of payment crisis that occurs. This is a very critical product line. And I believe we need to encourage foreign investment over here. And it would be best if some kind of joint ventures can be made so that local companies can actually level up their expertise and they can learn, they can integrate in the global value chain and become self-sufficient eventually in the production of medical devices and, start exporting as well. So that's the kind of transformation or journey that I feel is lacking here. And this situation may lead to continuation of higher imports, and they are going to grow. So foreign investment can actually, be conducive to sort of avert the situation over time, and maybe we can even start exporting one day.
Great, thank you.
Yeah.
Thank you so much. I think I don't have any other questions for now. So I just want to thank you again. And thank you so much for taking out the time to join us today and for giving this very insightful presentation. We really appreciate it. And if I might have some more questions, but I would probably email them to you if that's okay. And thank you so much again for coming on board for this.
No problem at all.
All right. I think.
Thank you to Gallup. Thank you, Bilal and Michelle. Thank you for this opportunity.
Thank you. Take care.
Take care. Bye.
Allah Hafiz.